Hello, my dear students. Welcome you all to Shri Jain Rank Zone classes. I am your mentor and your friend for the subject biology, and I will be taking the zoology part, that is animal science. My dear students, today we are going to start with respiratory disorders, as this is the last lecture of this chapter. We have already completed all the physiological part of human respiratory system, and now we are going to start with the respiratory disorders. The first respiratory disorder we are going to talk about is tuberculosis. Tuberculosis is an infectious disease. It is an infectious disease. It is a bacterial disorder caused by bacterium Mycobacterium tuberculoi. Okay, infection of several parts but common of lungs. Tuberculosis is not just limited to lungs, it can be of spine. The tuberculosis of spine is known as what? Pot spine. Mycobacterium tuberculei is a infection causing agent. Vaccination is done with the BCG, Bacillus calmette-guerin is the vaccine which is given against the tuberculosis. The test performed for this disease is Montauk's test. Okay. Pleurisy, also known as pleuritis, it is the inflammation of pleura or accumulation of pleural fluid. Presence of excess fluid in the pleural cavity is called hydrothorax. Presence of air in pleural cavity is known as what? Pneumothorax. The inflammation of pleura is known as what? Pleuritis. It is because of the accumulation of pleural fluid. Presence of excess fluid in the pleural cavity is known as what? Hydrothorax. And presence of excessive air in pleural cavity is known as what? Pneumothorax. Okay. There is some terms like pleural rub, the loss of surfactant, basically is the cause of friction between pleural membranes, which causes pleural rub. Okay. Now, the next slide, emphysema. Emphysema is a cigarette smoker's disease, also known as smoker's disease. Okay. It is a permanent, abnormal, pathological condition. It is a permanent, abnormal, pathological inflammation, pathological inflation of air spaces distal to terminal bronchioles. It is not inflation, it is inflammation of air spaces distal to terminal bronchioles due to destruction of pulmonary tissues, especially the alveolar septa, and flattening of alveolar ducts. There is little alveolar elasticity, loss of alveolar elasticity seen in emphysema, lung size increases but ventilation is poor. It is a permanent abnormal pathological inflammation of air spaces distal to terminal bronchioles due to the destruction of pulmonary spaces, pulmonary tissues, especially the alveolar septa, and flattening of alveolar ducts. There is little alveolar elasticity, means the loss of elasticity is seen. Okay, lung size increases, but ventilation is poor. Emphysema develops due to the infection, smoking, and chronic bronchitis. The disease cannot be cured completely because it involves irreversible change in the alveoli. Bronchodilators, antibiotics, and oxygen therapy are used to provide relief to the patient suffering from emphysema and retard progression of disease. Okay, so it cannot be cured completely because it brings irreversible changes in the alveoli. So, to minimize the symptoms, bronchodilators, antibiotics, and oxygen therapy are used. Okay, emphysema is preventable if care is taken to reduce exposure to smoke or air pollutants. Asphyxia. Asphyxia is the paralysis of the respiratory center due to excessive carbon dioxide concentration, commonly due to irreversible combination of carbon monoxide with hemoglobin to form carboxyhemoglobin. As we know that carbon monoxide is having 200 times more affinity than oxygen to combine with hemoglobin. So excessive amount of carbon dioxide commonly due to irreversible combination of carbon monoxide with hemoglobin to form carboxyhemoglobin. It results in death, common in closed rooms with coal burning or kerosene lamp. The asphyxia is the paralysis of respiratory center due to excessive amount of CO2 in blood, commonly due to irreversible combination of carbon monoxide. Pneumonia. It is a disease of lungs. Pneumonia is a disease of lungs with an incubation period of 1 to 3 days. It can be septic pneumonia. It can be infectious or pathological pneumonia. Okay. And characterized by accumulation of mucus or fluid with dead WBCs in alveoli and bronchioles, so that breathing becomes difficult. So, because of the over-secretion of mucus or fluid, along with the entanglement of dead WBCs in alveoli and bronchioles, the breathing becomes difficult. The incubation period is 1 to 3 days. It is a disease of lungs. It is of several types. Common pneumonia is caused by gram-positive bacteria, okay, called Streptococcus or Diplococcus pneumoniae. Other bacterium, fungi, virus, mycoplasma, or even some protozoans also produce the disease. So the gram-positive bacterium called Streptococcus or Diplococcus pneumoniae, other bacterium, fungi, virus, mycoplasma, and even some protozoans also produce this disease. Okay, it is common pneumonia. Bronchopneumonia. There are three types of individuals are more susceptible to this disease: elder, infants, and immunocompromised persons. The disease is of two types: bronchopneumonia, young children, elderly person, and lobar pneumonia, 10 to 50 years. Okay, the lobar pneumonia basically affects the persons of 10 to 50 years of age. Okay, the disease is of two types: bronchopneumonia, which involves young children and elderly person, and lobar pneumonia. It involves the immunocompromised persons having a age, it can be of any age, 10 to 50 years. The disease is transmitted through droplet infection. There is sudden chill, chest pain, cough with rusty mucoid sputum, rise in temperature, rapid shallow breathing, and reduced oxygen level of blood. Oxygen saturation level decreases due to the poor gaseous exchange. Abdominal distension is also common in bronchopneumonia. Useful drugs are erythromycin, tetracycline, sulfonamide. Bronchodilator drugs provide some relief. Untreated pneumonia leads to death. So bronchopneumonia is a type of pneumonia only, but it is of two types: bronchopneumonia and lobar pneumonia. Okay, and it basically infects the individuals belonging to three different age groups: elders, infants, and immunocompromised. The disease is characterized by sudden chill, chest pain, cough, and rusty mucoid sputum, rise in temperature, rapid shallow breathing, and reduced oxygen level. Oxygen saturation level decreases. Okay, because of poor gaseous exchange. Abdominal distension is also common. Useful drugs are erythromycin, tetracycline, sulfonamide. Bronchodilators are used, okay, to provide some relief. Untreated pneumonia leads to death. Hypoxia. Hypoxia or anoxia is the shortage of the oxygen level, oxygen supply to the body tissues due to normal shortage in air as on high mountain, anemia, histotoxic or poisoning of electron transport system. So it can be of, because of less amount of partial pressure of oxygen, okay, because the person is living on high mountain or high altitude regions. Anemia, if the person is suffering from anemia, then less amount of hemoglobin, or histotoxic or poisoning of electron transport system due to some poisons like cyanide. Okay. Hiccup. Hiccup is basically the inspiratory spasm caused by sudden contraction of diaphragm accompanied by loud closure of glottis. So hiccup or hiccups is basically sudden contraction of diaphragm when diaphragm undergoes sudden contraction and it closes, or it ends up with the loud closure of glottis. So sound is produced along with closure of glottis. Bronchial asthma. Bronchial asthma includes cough, violent expiration for expulsion of mucus and particles. Cough mean bronchial asthma is correct. Bronchial asthma is a inflammatory disease. Cough. Cough is the violent expiration or expulsion of mucus and particles. Whooping cough or pertussis. It is a bacterial disorder. Cough with inspiratory woof caused by Bordella pertussis or Haemophilus pertussis. It causes whooping cough. Okay. Cough and whooping cough are different. Bronchial asthma due to narrowing of bronchi. Okay. Spasmodic narrowing of bronchi and spasm in bronchial muscles. The disorder is generally due to hypersensitivity of bronchioles to foreign substances. There is an intense coughing and difficulty in exhalation because of overproduction of mucus. Mucus glands becomes more active, producing a lot of mucus that clogs bronchioles and bronchi. Exposure to all allergens should be avoided. Bronchodilators, inhalers, steroidal and non-steroidal are used. Antibiotics are given for relief and protection against infection. So bronchial asthma is a basically inflammatory disorder. It is because of the hypersensitivity of one, you know, due to narrowing of bronchi and spasm in bronchial muscles. The disorder is generally due to hypersensitivity of bronchioles to foreign substances. There is intense coughing and difficulty in exhalation. Mucus glands become more active, producing a lot of mucus that clogs bronchioles and bronchi. Exposure to allergens should be avoided. Bronchodilators, inhalers, and antibiotics are given for relief and protection against infection. This is bronchial asthma. You can see this is the smooth muscle layer, blood vessels, lumen, and mucus lining. Okay, the contraction of smooth muscles. This is the contraction of smooth muscles. Blood vessels infiltrated by immune cells, dead RBCs, dead WBCs, and all. decreased lumen diameter, which decreases the airway passage, and large amount of mucus secretion, excess of mucus. Okay, it is because of the inflammation and swelling because of hypersensitivity. Okay, hay fever is also a allergic disorder, an inflammatory disorder. It is an allergic disorder of nasal lining. It develops due to hypersensitivity of lining to pollen grains or any other foreign particles. Hay fever, it is also an allergic disorder of nasal lining. It develops due to hypersensitivity of the lining to pollen grains or any other foreign particles. Atelectasis. Atelectasis. It is an inability of lungs to expand at birth. This is mainly due to deficiency of surfactants. Silicosis is an occupational hazard. It is due to the long exposure to dust containing silicon compounds. Workers of glass industry, potters, gold and copper miners develop progressive fibrosis in the liver. Okay, it is an occupational hazard. Asbestosis, it is due to inhalation of asbestos fibers which may result in the cancer of pleura. Asbestos is a carcinogenic agent. Diphtheria, it is a bacterial disorder caused by Corynebacterium diphtheria of upper respiratory tract that produces pseudomembrane in throat. Pseudomembrane obstructs breathing, causing hypoxia. Upper respiratory tract. Okay. Bronchitis is the inflammation of bronchi and bronchioles due to hypertrophy and hyperplasia. Hypertrophy is increase in size and hyperplasia is increase in number. ठीक है, there is a regular coughing with thick greenish yellow sputum indicating infection and excessive secretion to mucus. Because of excessive secretion of mucus, the bronchioles they get blocked. Because of the bronchioles blocking, the airway passage get blocked and the person suffers from hypoxia. The bronchitis is the inflammation of bronchi and bronchioles due to hypertrophy, that is increase in size, and hyperplasia increase in number, and seromucous glands and goblet cells. Okay, so these seromucous glands and goblet cells they produce more and more amount of mucus which blocks the bronchioles and the airway passage get blocked. There is a regular coughing with thick greenish yellow sputum indicating infection and excessive secretion of mucus. It is commonly caused by viral infection of nasal tract followed by bacterial infection, that is secondary infection. Secondary infection. Okay, the disorder is common in smokers and persons exposed to carbon monoxide rich polluted air. Persons suffering from bronchitis should avoid smoke, irritating chemicals, and pollutants. Bronchodilators provide symptomatic relief. Antibiotics are used to cure infection. Okay, cyanosis. It is the bluish coloration of skin, maybe due to hypoxia and mucous membranes due to the reduced hemoglobin in blood. It may be due to either less amount of oxygen pressure, less O2 tension in blood, or in blood, or less amount of hemoglobin. Okay. Epistaxis. It is nose bleeding, quite common due to any scratching of nasal membrane. Nasal membrane is highly vascular. Epistaxis also occur due to hypertension. It also occurs in the as a form of altitude sickness or mountain sickness. Okay. Pharyngitis is the inflammation of pharynx. Laryngitis is the inflammation of larynx. Sneezing and involuntary, sudden, violent, audible expulsion of air through mouth and nose. Okay, that is sneezing. Yawning, it is a deep, involuntary inspiration with mouth open, often accompanied by the act of stretching, basically because of high CO2 concentration in alveoli. Okay. So pharyngitis is the inflammation of pharynx, laryngitis is the inflammation of larynx, sneezing and involuntary sudden violent audible expulsion of air through mouth and nose. Yawning is the deep involuntary inspiration with mouth open, often accompanied by the act of stretching. SARS, subacute respiratory distress or syndrome, it is a killer atypical pneumonia called severe acute respiratory syndrome. The disease is caused by variant of common cold coronavirus, which spreads by droplet infection and other methods. There is initial fever 100.4 degree Fahrenheit, headache, body ache, dry cough, and then difficulty in breathing. Okay, so SARS subacute respiratory distress. Nowadays, we are running with the pandemic of COVID-19. That is also coronavirus infection. Okay, occupational lung disease, black lung disease affect coal workers. Chronic beryllium disease, it affects workers in variety of metallurgical occupations. Byssinosis, brown lung disease, it often affects cotton and textile workers when bacteria released from cotton or other material are inhaled and grow in lungs. Occupational asthma, it can affect people who work with variety of materials like dyes, resins, leather, latex, and rubber. So byssinosis, chronic beryllium disease, and black lung disease affects coal workers. Chronic beryllium disease affects workers in a variety of metallurgical operations. And byssinosis, brown lung disease, it often affects cotton and textile workers when bacteria released from cotton or other material are inhaled and grow in lungs. It is always advisable to undertake preventive measures in workplace involving pollution. Okay, risk by reducing emission of harmful dust and chemicals, using protective gear and clothing, short duties mean switching over the duties again and again, informing workers about risk and preventive measures, and regular health checkup. Mountain sickness. It is hypoxia or oxygen shortage syndrome which occurs at the altitude of a height of 3,500 meters and above. There is decrease in atmospheric pressure as well as oxygen content of atmosphere. Reduced atmospheric pressure reduces the amount of air taken into the lungs during inspiration. Reduced oxygen contents reduces its partial pressure and rate of diffusion into the blood. Hypoxia increases. As a result, body obtains less O2 and therefore produces less energy. However, requirement of energy at high altitude is higher due to the low temperature and increased physical strain. Effects of deficient availability of energy begins to appear within 8 to 24 hours. So because of less amount of oxygen at high altitude level, the oxygen carrying capacity of blood decreases. The reduced oxygen content reduces the partial pressure of oxygen in blood. Okay. The diffusion rate of oxygen decreases means the condition of hypoxia appears. As a result, body metabolic rate decreases. The production of energy in the form of ATP decreases, which appears in the form of different presentable symptoms within 24 hours. It is characterized by breathlessness, fast breathing, nausea, vomiting, cyanosis, headache, muscular weakness, and mental fatigue. After some time, the symptoms subside due to the increased concentrations of 2,3 diphosphoglycerate in erythrocytes that attracts more oxygen to form HbO2. Even partial pressure of oxygen is lower. Soon rise in hemoglobin and erythrocytes count shall start because of the production of erythropoietin. Erythropoietin hormone. ठीक है. Terms related to breathing are eupenia, normal breathing; hypopenia, slower breathing; hyperpenia, rapid breathing; apnea, no breathing; dyspnea, painful breathing; orthopnea, difficulty breathing in horizontal position; tachypnea, rapid shallow breathing; polypnea, rapid deep breathing; hypercapnia, excess of CO2 in blood; hypocapnia, low CO2 in blood. So low CO2 in blood, hypocapnia, excessive CO2 blood, hypercapnia, polypnea, rapid deep breathing; tachypnea, rapid shallow breathing; orthopnea, difficulty breathing in horizontal position; dyspnea, painful breathing; apnea, no breathing; hyperpnea, rapid breathing; hypopnea, slower breathing; and eupnea, normal breathing. So that is all for today. We have completed the chapter. Now we will discuss the we can the need time for this chapter and for the human digestion. Till then, bye bye. Take care. Stay safe.